Good morning, everyone. We are here for the Georgia ambulance training, and we'll be ready to get started in about a minute. We'll give everyone about 1 or 2 more minutes to join. Thank you.
Good morning, Revenue Division. May we help you?
Okay, let's get started. Good morning, everyone. We are here for the Ground Ambulance Assessment and Payment Program presentation for Georgia Medicaid. And we have sent out notices. I'm glad to see so many of you participating today. Today we're calling this our financial survey training, but we're going to also provide an overview of the program and then walk through the survey that we're going to ask providers to prepare. My name is Margaret King. I work for Myers & Stauffer. We're a public accounting firm. We have worked with government healthcare agencies for over 40 years, and we're glad to be partnering with the Georgia Department of Community Health on this project. We are the Medicaid audit and reimbursement contractor. We also, for this project, are assisting DCH in collecting survey data, calculating supplemental payments, and developing the associated assessment. And we'll go through all of those parts of the project today in this training. I'm a healthcare senior consultant for Myers & Stauffer, and I've worked for Myers & Stauffer for a couple of years and then worked for over 25 years at a state Medicaid agency and have a good bit of experience in programs like this one for Georgia ambulance companies. I'd like for Tim, are you available to introduce yourself?
I am. Can you hear me?
Yes.
Well, good morning, everyone. Tim Garant. I'm a partner with Myers & Stauffer. I've been with our firm for about 20 years and have worked with a number of programs like this one in other states. And I've also been working with the Department of Community Health on ambulance-related payments, including the governmental provider payment program over the past couple of years. And it's great to join you all today. We look forward to the conversation.
Okay, and Barry, will you please introduce yourself?
Hello, my name is Barry Bingaman. I am a senior manager with Myers & Stauffer. I've been with the firm about 13 years and worked on similar projects and have similar experience as Tim noted, so I won't list those all out again, but glad to be here and happy to get this project started.
And joining us today is Angelica Clark from the Georgia Department of Community Health, and she will introduce herself and Kim.
Good morning. I am Angelica Clark with reimbursement at the Department of Community Health. I am the senior manager over nursing home reimbursement and non-institutional reimbursement where the ambulance program resides. Kim Morris, who is the director of reimbursement, had a scheduling conflict this morning. But we also have Michael Henderson on the line. He is the financial analyst supervisor and will be managing the ambulance program. I'm glad to be here today. Thanks.
Thank you, Angelica. So for the purposes of this training, we have muted everyone's line, And we'll ask that you look for and find the chat box. It should be in the top toolbox of your screen for WebEx. And if you'll enter your comments in there or your questions during the training, we'll stop periodically and get those answered for you. Today's training, we will concentrate on an overview of the program. What are the assessments? What about the supplemental payments? We'll go through the financial survey, and I'm going to break for just a moment and mute everyone. And okay. All right, sorry about that. So we're also going to go through key dates and next steps for this program. And we'll answer your questions throughout, and then also at the end, if you have additional questions, we'll be glad to answer those. Our audience today is the ground ambulance providers in the state of Georgia. Some of the initial notices went out to medical first responders. If you do not have an ambulance program, then this program does not apply to your entity. And if you to stay throughout the program, that's fine, but I just wanted to let you know on the front end that if you received this ownership checklist and announcement letter and you're a medical first responder, we apologize if we sent those out to non-ambulance providers. We used the emergency licensee list from the health department and may have sent some of these notices to the medical first responders. So just want to make that clear before we got too far into the program. First of all, hopefully all of you are participating in the Medicaid program and you are aware basically of how it works. But for those of you who may not be familiar with how it's financed by the federal government, and then the state puts up money as well. In the case when providers are able to put up money, I mean, a lot of the funding is going to be provided through appropriations, but there are other resources for those state share of payments for local funds. And when provider payments are used, there are three options there: certified public expenditures, intergovernmental transfers, those are made by public providers, and then healthcare provider taxes, which are sometimes called assessments or fees. And those are the ones we're going to talk about today. Supplemental payments are another part of this program. The important part, you might think too, and that is where additional payments are made for Medicaid claims. So when Medicaid services are provided, the provider submits a claim, it's paid, and they get the normal paid rate. In addition to that, a supplemental payment can be made through a program such as this one that DCH is opening up for ambulance providers. The payments are subject to federal upper payment limits. Those can be either cost, using the Medicare payment levels, or average commercial rates. Today, we're going to talk about average commercial rates because that is the process we'll use for this program. Why do we have the program? We have this program because the legislature in the Georgia Assembly passed House Bill 271. And what they did was pass a law that authorizes DCH to develop this assessment program. The purpose is to fund the state share of these Medicaid supplemental payments for ground ambulance provider, well, for a subset. And DCH selected the assessment program for privately owned private ambulance providers. This Bill 271 is now known as Georgia's Act 186. program requirements. Okay, the program requirements are authorized by state law, but they are also subject to those federal requirements that were mentioned in the previous slide. In order to have a program of this type where supplemental payments can be made, there must be a funding stream for it. And the funding stream for a provider tax or assessment or fee is that the participation is mandatory for all ambulance providers within that group. So that will be all private ground ambulance providers. Therefore, all private ground ambulance providers will be required to pay the assessment. But we also have a survey today, and we're asking that all providers, both public and private, complete the financial survey. And then one more important thing to note is that the supplemental payments are based on Medicaid volume. So there must be Medicaid specific claims activity in order for a provider to receive payments back from the program. Now that doesn't drive whether or not they pay the assessment. All providers have to pay the assessment. But driving supplemental payments is the Medicaid participation. Well, I want to pause right here and ask Barry if we have any questions or comments so far that we need to answer.
No questions or comments so far.
Okay, so just a reminder, everyone, if you have any questions or comments, please enter them in the chat box. Assessments are used to fund the federal matching payments for any supplemental payment program. In this situation, we are going to have a private ambulance payment program. And when these assessments are determined, they are basically going to be backed into by the allowable payments and then determine the total cost of that. Then you have to take into consideration what the federal matching rate is. The federal government provides a matching rate, and then the state has to put up the remainder of the fee. Well, since this will be supplemental payments for providers, the legislature set it up so that providers would also make the state share payments. In other words, the ambulance providers will be putting up the state share, but the ambulance providers will also benefit from the program. The assessment will be allocated across providers either using revenue information or transport information. So you'll see on the survey that we're collecting both revenue and transport information. Here is some information on the federal matching. For the state of Georgia, the regular FMAP, which is the portion of the payments that the federal government puts up, is 67.03. Right now, during the public health emergency, there is an additional 6.2% in FMAP that is being provided to states. So right now, Georgia has to put up 26.77% of payments. Now that 6.2% will last through the end of the quarter during which the public health emergency ends. So it's ideal for a program such as this to have additional federal funding because that reduces the amount of assessment that has to be collected to fund the payments. In an example where DCH collects assessments of $26.77, pays out $100, they pull down $73.23 in federal matching funds. So you can see that if the ambulance providers as a group put up $26 and get $100 back, they have a benefit of $73 in this example. Okay, and that's for every $100 that's spent on the program. This is the benefit right now. Now that if the 6.2% goes away and the public health emergency ends, then the $26.77 is going to go up to $32.97. It's still quite a significant return on your investment. We mentioned we'd be collecting revenue data and transport data to develop the assessment. One or the other will be used, and we're collecting both because there is the potential that either revenue or transport data will provide a better overall value to ambulance providers as a whole. So what we want to do is to gather the information and then evaluate the impact of the assessments and the corresponding supplemental payments across providers. And we'll use various designs to do that. And what our goal will be to do is to limit, is to increase the number of providers that will greatly benefit from the program and mitigate any negative impacts. Once those models are prepared, DCH is going to share those with stakeholders and gather input. That is where you will need to be involved again, because what we will need you to do is to review these models and participate in providing feedback to the Department of Community Health. The Department of Community Health will take their review of the models and then also take any feedback from stakeholders and make a decision about the program and make a presentation to the Board of Community Health, who will have to approve the program. And then following the Board of Community Health's approval, CMS must approve it, any supplemental payments program. We'll go on to slides to discuss the supplemental payments. DCH has selected the following HCPCS codes for supplemental payments for application to the fee-for-service claims. You can see it's AO425. These are all of the codes that are approved for Medicaid ground ambulance services at the time that the public program was put in place, and the same HCPCS codes will be used for this private program. And I mentioned a public program because the DCH has been gathering information and is implementing a program for publicly owned ambulance providers. And this particular survey applies to all, but if you're a publicly owned provider and you haven't already submitted information on surveys for the public program, we encourage you to contact us for more information or to reply to previous correspondence on that. That is real important for you to understand that whether you're a public or privately owned ambulance company, you will qualify for either the publicly owned supplemental payment program or the privately owned supplemental payment program. Okay. And we do still have some publicly owned providers that are not participating in that public program, which is optional. This program for the privately owned is not optional, but the public was. So how do we determine the provider-specific payment rates for the supplemental program? Well, what we're going to do is use average commercial rates for each of those HCPCS codes. We'll have calculations that will be based on information provided in Schedule 3 from the private ambulance companies. And then we'll prepare separate average commercial rate calculations for each code and each provider. And then once those are calculated, which we have an example we'll show you, then the program will rely on service volume through the fee-for-service program at this point in time. And that will tell us the volume, and then lump sum provider payments will be made periodically. Here's an example. Let's just say you have an example HCPCS code A0. And during the survey period of January through June 2021, your ambulance company received payment from 5 commercial payers. That's non-governmental, non-auto insurer, just commercial payers. And those commercial payers made payments of these 5 different amounts: $82.30, $91, $90, $75, $84, and $89.25. So you report those 5 commercial rates to the program, and then we calculate an average commercial rate for your code of $87.46. We then apply that average commercial rate of $87.46 to the Medicaid service volume. In this example, we had 100 transports, and we calculated an upper payment limit of $8,746. Through the fee-for-service program, when claims were submitted, the Medicaid claims payments were $4,975. So the provider had already received $4,975 for these claims, leaving a balance of $3,771 eligible for the Supplemental Payments program. So in this example, the provider for this HCPCS code would be eligible for an additional $3,771 for this payment period. Okay, Barry, do we have any questions?
We do have a question.
Okay.
The question is, to confirm, the state is not putting any funding towards the fee, and the fee will be paid by the providers.
Yes, that is correct. And that is very typical in a program such as this one, where the legislature or the normal state funding process funds the regular Medicaid claims payments, such as the $4,975 in this example. And then any supplemental payment programs is typically funded by the providers themselves. Thank you for your question.
Okay, we have another question. Of the $3,771, how much would we have to spend out to receive that amount of funding?
Okay, well, that's a good question. It's not, okay, so overall, the ambulance providers would have to, at this point, pay the 26% in taxes. So we would take that $3,771, multiply it by the state share percentage, and that would be the portion, so roughly $1,200 would be the portion that the ambulance providers as a whole would have to provide for the program. And the interesting and difficult part of this program is that the supplemental payments are made directly to the provider based on their actual service volume and their actual average commercial rate. However, the assessment has to be collected on a broad-based term, such as all transports or revenues. So you may have a provider with in other words, your fee is going to be based on a different indicator than your payment. So this provider would not necessarily pay exactly the 26% of the supplemental payment.
Right, we have another question, which I think you kind of covered, but just to make sure everyone's clear, how is the fee calculated per provider?
Okay, we're going to model the fee across providers. So what we'll do is if we make a determination that the fee will be based on net patient revenue, we'll have collected the net patient revenue for all of the private providers, and we'll determine the assessment needed to cover all of the supplemental payments. Whatever that total assessment is will then be allocated across providers based on their overall net patient revenue. And note the overall net patient revenue in this case would not be just Medicaid revenue, it would be all revenue. Likewise, if transports were used instead of net patient revenue, it would be all transports, not just, well, it can be adjusted for non-Medicare and some other different scenarios, which we will look at in modeling. But the main point I want to make here is that it's not going to be based on what your supplemental payment is. Now, in the public program, the intergovernmental transfer that is submitted is based on the supplemental payment for that provider. But in the private program where we have to do the provider fee, it's not. Did that answer your question, I hope?
I will monitor for any clarifications for that, Margaret. We did have another question come in the meantime.
Okay.
Do we have to complete an individual ground ambulance assessment owner checklist for each Medicaid provider number within our organization?
Yes, we do need a separate ownership checklist for each organization, with each provider number.
That was the last question thus far.
Okay, thank you. Can you see the survey up on the screen?
We can.
Thank you. Okay, well, this is the survey form. You hopefully received this in an email yesterday. And I guess based on just saying that, I would like to stop and ask if any of you who are participating received this notice from another ambulance provider and didn't receive notice directly from us. Will you please provide your contact email information in the chat box today, or subsequently send us an email to the georgiaambulance@mslc.com box. We want to make sure that our contact list is including everyone who needs to be kept abreast on this program. Thank you.
Margaret, we did have one follow-up question come through here before we look through the survey.
Okay.
Will the fee be adjusted by the size of service? For instance, we presumably would not pay as much as a smaller company versus a corporate entity.
The volume of revenue and the volume of transport would presumably be higher for the corporate entity that you're referencing. So yes, since the payment will be based on either revenue or transport volume, the higher the volume, the higher the assessment. The lower the volume, the lower the assessment.
Okay, we've got some more questions popping in.
Great.
Does this program apply to facilities that only provide neonatal transport to and from a regional perinatal care center?
Do you provide services for Medicaid that apply to the list of HCPCS codes that we listed? And if not, if you can let us know what that code is, we can evaluate that. There may be just one provider that is licensed only as a neonate transporter in the state, based on my recollection from the list that we received from the Department of Health.
Another question. Is the average commercial rate based on the insurance company's allowed amount or the actual payment received from the insurance company?
Good question. That's actual payments, collections. That is based on collections. That's maybe, Tim, I need you to answer that question, I think, because I was answering for the revenues that were collected.
Yeah, I was trying to unmute myself. Hi, can you all hear me?
Thank you. I think
Yeah.
I just answered that incorrectly.
Yeah, so I did want to make a point of clarity here. So so there's really, as Margaret has been describing, there's two distinct parts of this program. There is the payment side of the program in which Medicaid payments will be made. That side of the program is based on an upper limit that the federal government will not allow the Georgia Medicaid program to make payments in excess of, and that upper limit is the average commercial rate. And to this particular question, the average commercial rate needs to be the allowed amount. We don't want a reduced payment amount if there's a reduction that the insurance company makes. What we're looking for the average commercial rate side of this project for purposes of calculating the Medicaid payment upper limit is the allowed amount from the insurer. On the assessment side, and we'll be talking about that as we go through the survey, the data collected in Schedule 2, Revenue and Transport, what we're looking for there is collections, actual cash collections. And that is not restricted to commercial payers. We're looking for all payers. And I don't want to get ahead of ourselves, but I did want to make that point of emphasis because it is different. Those are two different revenue figures. Thank you.
Thank you for stepping in. As soon as I answered that question, I realized I made an error. Okay, good. So I just wanted to, okay, Barry, do we have any more questions right now?
The last question is if the PowerPoint
Good.
will be made available on the state's website.
Yes, it will be. Yes, the survey and the PowerPoint will be uploaded to the website, as will the recording. So I wanted to just, we're going to go through slides that discuss the survey, and I wanted to bring it up on the screen first before we do that. And we'll actually come back through and walk through it. But here are the instructions for completing the survey on the first tab. And then notice we have 3 schedules. One, which is provider information, revenue and transport data here, and then the Schedule 3, which collects the average commercial rate information from providers. And if you have that available to look at while we go through the next few slides, that may be helpful. Okay, I'm going to take us back over to the slideshow. All right, can you all see the slideshow again?
Yes.
Okay, thank you. Okay, the purpose of the survey, again, we're going to repeat some of this information, is to collect information for use in designing and implementing both the assessment and the supplemental payments, and to model program impact on providers. The survey collects provider information from every ambulance provider, revenue and transport data from every ambulance provider, and then information from the private ambulance companies' top 3 to 5 commercial payers. Okay, this survey, Schedule 3, is for the private ambulance providers. If you're a public ambulance provider, we need you to fill out Schedules 1 and 2. But if you have commercial payers, we'll need you to submit those on the public program commercial payer survey, which we can provide to you. We recommend that you read through the instructions completely before filling out the survey. And we want you to know that the survey is locked and cannot be edited except for the green data entry cells. So while there are a lot of spaces on the survey, we don't want you to be too overwhelmed, and just know that it's just those green data entry cells that we need you to complete. Again, all ambulance providers need to complete Schedules 1 and 2. And then we need private ambulance providers to pay a special attention to Schedule 3, which will require completion and also the submission of commercial rate supporting documentation. I've mentioned private versus public. Public entities are government owned and operated. So if you're not government owned and operated, then you are a private ground ambulance provider. And we want to, we must limit this program to the licensed providers in the state. If you're a private ambulance company, providing services for a public, such as a county, but you are a private entity, then you qualify for the private ambulance provider program. Okay, Schedule 1. On Schedule 1, we're going to collect identification information. And the important thing to note here is that we and DCH require that you must sign this certification, and the signature must be by an officer and or executive of the organization, and we need hard copy signatures on but scanned on a PDF is fine. I said hard copy. We need original signatures, but a PDF scan is fine. And note, if you're not a Medicaid provider at this time, you're welcome to apply, but lines 5 and 7 won't apply to any providers other than Medicaid providers. Here on Schedule 2 is where we'll report net revenue collections and billable transports. Okay, so you're going to report data for transports that originate in Georgia only. If they end out of state, you still count them. If they originate out of state, please exclude them. Paid dates are January through June 2021 for the survey period. If you only have, and we're collecting, okay, so your collections and revenue transports for January through June 2021, that's your time period. Regardless of when you provided the service, we want to know what those paid dates, what those payments were during those time periods. We also ask that you separate the data between Medicaid and other payers, emergency versus non-emergency, and the listed codes versus other HCPCS codes. You'll see that on the survey when we get that open. Schedule 3 collects commercial payer rate information. We want you to select 5 commercial payers. If you don't have 5, we can accept as few as 3. These listed do not qualify as a commercial payer: Medicare, Medicare Advantage, HMO, TRICARE, Medicaid, workers' comp, and auto insurance plans. Please do not include those. We can't count those. Schedule 3 collects paid dates January through June 2021 information. If you have less than 3 payers within that date range, you may extend it up to 6 months before or 6 months after the program to pull in payment rates for 3 commercial payers. We also need to collect supporting documentation for Schedule 3. So while you're going to fill in Schedule 3 with your commercial payer rates, we also need you to provide supporting documentation. This is either a paid remittance advice, an EOB, or a similar payment record documenting the allowed payment amount, and it must tie to the payment rate reported on Schedule 3. And please, please, please be careful. Do not submit protected health information. We need you to mask it and do not submit it. So this is a reminder. We know you know not to, but we don't need it, and we need you to please mask it. Okay, so we're going to go back now to the Excel file, the survey. And Barry, if you would please let me know when that's visible.
I can see the survey.
Okay. All right, so we have several sections within this instructions, which is on the first tab. And so please read through this very carefully. We have included all the information we think you will need to complete the survey. And if not, you are welcome to submit questions to us. Once you have the survey ready to submit, we're asking that you submit it electronically through our secure FTP site. And what that will require is that you prepare an FTP account by requesting an account through georgiaambulance@mslc.com. And we are collecting it all through this means to ensure a secure receipt just in the event that PHI is accidentally submitted. And
Margaret,
also, yes?
can you make your screen just a touch bigger? We've had a request from the audience.
Oh, yes, I can.
Thank you.
Here we go. So, again, if you will, please request an FTP account be set up for you, and then we can make sure that you can submit your survey information securely. Please note for Schedule 1, all providers must complete this section, regardless of ownership type, okay? And we'll need the certification statement signed and submitted through a PDF. The revenue and transport data must be completed by all providers. And note here we have a please note section. Payments reported are net of contractuals and any bad debts. Reported for collections of transports that originate in Georgia. Exclude collections from air transports. And then for column 1, we would like for you to include payments received from Medicaid, fee-for-service, and Medicaid managed care only, and then all other payers in column 3. If you have 0, please do not enter not applicable. I think it won't allow you to. We want you to leave that blank if you don't have an entry. And just if you would follow through these instructions, there are a lot of instructions here that just help guide you through any questions you may have about what to include or what not to include. For transports, you're going to include the billable only, and they correspond to the payments reported in the previous columns. Again, transports only originating in Georgia, only ground transports, and total transports where payment was received from either Medicaid fee-for-service or Medicaid managed care in column 2, and all other payers in column 4. So this is where we don't want you to include transport units. So for example, if you have mileage and you have units, please do not enter that as a transport. And then for Schedule 3, again, this is for private ambulance providers only. If you're a public ambulance provider, you should have already completed a survey such as this, or we can get one to you to prepare for the public program. We're emphasizing this because we don't want public providers to complete this information unnecessarily. And so we have a drop-down menu at the top of the page. If you select public, you won't be able to complete the form. But if you are a private provider, it's in your best interest that you complete this so that the DCH can make the payments to your entity for the supplemental payment program. Okay. I won't spend time on Schedule 1. Schedule 2, I want to show you that it's split between ground emergency services and ground non-emergency services. So we have 2 sections here. And we have columns for Medicaid collections, Medicaid transports, and then all other collections and transports. And then for Schedule 3, for each of the procedure codes that are included for payment, we have space for listing 5 commercial payers. And here what we have is a space for you to enter the name of the file for the supporting documentation. So for example, in cell E24, you're going to enter a commercial payer rate. And then in the next cell, E25, you're going to put the name of the file with the supporting documentation that aligns with this rate for commercial payer 1. And you'll do that throughout the entire list of survey codes. So that's the supporting documentation files you'll name based on payer. We have some suggested naming conventions here, such as payer 1 _ A0425 could be your name for your file. Overall, when you save your file and upload it to the FTP site, your survey file, we want you to add your Medicaid provider number and your name. And we've got that in the instructions as well. So if you're a private ambulance provider, you'll be submitting the survey back, the PDF for Schedule 1 certification, and then all of the supporting documents. If you're a public provider, we ask that you submit the survey form back and the certification form for Schedule 1. Okay, Barry, I'd like to pause here for any additional questions.
We do have a couple more questions. For Schedule 3, can Medicare or Medicare replacement plans be considered as a commercial payer for the use in this survey?
Medicare cannot be considered for this plan, no.
This is Tim. I would just like to emphasize that because we did have a bit of confusion in the past with the public provider program. That is correct. Medicare payers, the Medicare program, as well as Medicare Advantage payers, essentially any contracted governmental payer of any kind is not a commercial payer and should not be reported.
Okay. The next question, if a public ambulance company did not opt into the previous surveys, are they then required to complete Schedule 3 as well as the private providers?
The answer is no. What we would like for you to do if you're a public provider and you haven't previously submitted Survey 1 or Survey 2, you may still do that. Okay, so under the public program you had the first survey period of January through June, and then a July through December of 2020 survey period, and you're still eligible to submit those. The cutoff will happen at the point in time when CMS approves those payment programs and the payments are made, but right now the window is still open.
Next question is to clarify the data to be utilized in the survey. Are you looking for dates of service between January and June, or the date of the payment made from the insurance company be between January and June?
Okay, good question. The paid day range is what we're looking for. Okay, so if it was paid during the time period of the survey, then it is eligible for entry onto the survey. And again, we have a 6-month extension before and after the survey period. So we're looking for paid dates.
Okay, next question. Are you requiring EOBs for all funds or sampling only?
We need an EOB or a similar document for each code and for each commercial payer. So in the example of a provider who has 5 commercial payers for 5 of the codes, they would submit 25 EOBs or similar document or supporting documentation. And up to 35.
Next questions regarding the FTP accounts. Will we need to request a secure FTP account for each individual Medicaid number, or will we be able to upload multiple provider IDs surveys through a single FTP account?
Yes, Tim, would you please speak to that?
Yes, sure. So you do not have to request a separate FTP account for each Medicaid ID. If you are an authorized individual to report this information for multiple Medicaid IDs, then you can use a single FTP account for that information. So for example, in the public provider program, we know there are a number of cases of billing organizations who have the EOB and other billing information that we're looking for here. And those billing contractors oftentimes supply that information on behalf of their client ambulance providers. If that is the situation here, the billing provider is able to submit the information for their client ambulance providers as long as you have the authorization from your associated client ambulance provider to submit the information on their behalf.
A comment on the survey instrument. It looks like the Medicaid provider field is not allowing alphanumeric characters be entered, and asking if we should just have those hand keyed in when they're printing off to sign the scan.
That is a good workaround. Thank you for that. What we'll also, when we put this up on the website, we'll correct that. Sorry about that. We weren't even aware of that error. Thank you for bringing that to our attention.
Okay. Next question. If a facility or an ambulance service is a non-emergent transportation facility and we do not provide transport to patients with commercial insurance, how will we fill out Schedule 3?
Okay, that's a good question. If you don't have any commercial payers, then you will need to explain in the box at the bottom of the schedule that you don't have any commercial payers. And in the program, it may be possible for DCH's program to assign an average, a statewide average, for an example, for payers, and we will need to just evaluate that as we go through the program and make a determination how it will be set up in the state plan. But what you will need to do in that situation is just complete the box at the bottom of Schedule 3.
Okay, the next question. For public providers, is it required to complete both timeframes for the public survey, or must we only complete one?
Could you repeat that, please?
For the public providers that did not previously complete the public survey, is it required to complete both timeframes or just one?
For participation in both programs, you will need to submit the survey for both periods. But again, the public program is not mandatory, it's voluntary. But for participation in both, you will need to submit the information for both.
Okay. We have a question regarding the due date of the survey.
We would like those submitted by October the 5th, please. So roughly 3 weeks.
And then a question asking if the link to the PowerPoint survey and other information will be provided.
Yes, it's in some of our later slides, and we'll read that out to you in case you're on without the slides.
That was the last question.
Oh, perfect. So that segues into our next slides. I'm having a technical difficulty here. Here we go. Okay, next we're going to talk about survey submission. We went through this already. All providers need to submit Schedule 1 and Schedule 2. And when you name the file and you submit it, please append the Medicaid provider number if applicable and the provider name. And again, here on that signed certification, if you would, please enter in your Medicaid number. Thank you. And then for Schedule 3, private providers only, we're going to need you to fill out Schedule 3 and then submit your supporting documentation, redact your protected health information, and have a separate file for each payer and each procedure code, and then let us know the file name that corresponds with the rate that you have entered on the Schedule 3. Please submit the surveys by October 5th. We would like the electronic submission of the form, the Excel form. Again, redact all protected health information. Use the secure file transfer protocol. And you can set up your account. If you're a public provider and you already have an FTP account set up, please use that one. And if you don't, please request an account by emailing georgiaambulance@mslc.com. Key dates and then next steps. So for this program, if we have any questions regarding the surveys, we'll issue those questions and we'll collect responses. Then we will review all of the survey information and calculate the ACRs. Next, we'll prepare models. And we'll review those with DCH, who will then ensure that the model results are shared with stakeholders and input will be sought. Then the DCH board will receive the program outline and details for approval. And once that is gained, the state plan will be submitted for CMS approval. The state plan is the document the Medicaid program uses to gain CMS's approval for their payment of federal funds. So in order to draw down the federal funds for this program, CMS must approve it. And once that process is complete, then the initial provider assessment will be sent out to providers and collected, and there will be correspondence throughout this process, but then there will be the initial supplemental payments issued to Medicaid providers. We just wanted to give you what the steps are, the major steps for this program, so you know what to expect. And we've gone through a lot of questions, but Barry, I wanted to go through these resources that we'll have on the website. The ownership checklist and that original announcements letter are already on the DCH website. The financial survey will be added. We'll have a FAQ for frequently asked questions that will put your questions on there. We'll also add this slide deck from today and the recording. And let me read out the DCH website to any of you on the phone. dch.georgia.gov/ground-ambulance-UPL. So that's dch.georgia.gov ground-ambulance-UPL. And on this last slide, we have contact information for both Myers and Stauffer and for DCH. And we'll add Michael Henderson's contact information as well before we post this on the internet. Barry, additional questions? Hi, Barry. Do we have any additional questions?
So sorry, I was on mute. Yes, we do. The first additional question we might need a little clarification on, but the question is, if previous surveys were sent to georgiaambulance@mslc.com, were they received? Is
Well, right. So we have an opportunity to look through and make sure of that, but our Georgia ambulance box is monitored daily. So I suspect if so, then we receive them. If you want to send a follow-up email to Georgia Ambulance, we can double check that and let you know.
the next question, are the public companies required to submit payment information, or is that still voluntary? So this question is coming from the same um, entity seeking clarification on participating in the public survey period 1 and 2. So if you're asking, do you have to submit in the public, that's voluntary, but you would need to complete this survey, schedules 1 and 2. But if you're public, Margaret, correct me if I'm wrong, they would not need to complete schedule 3 if they still wanted to opt out of sending the average commercial rate data.
That's correct.
And then last question right now, do we have to obtain new FTP access if prior surveys were submitted to Myers and Stauffer through an FTP account?
No, you do not. You may use your prior FTP account.
Believe I've covered all the questions. I also received some email addresses from folks asking for a copy of the survey. I've got all those documented. If there's any questions I've overlooked, please resubmit them through the chat.
And while we're waiting to see if there are any additional questions or comments, I want to take a few minutes to thank everyone for your participation in the training today and for your interest in the program. And please know that if you have any questions or concerns, please share those with us, and we'll be happy to get back with you right away with any information that you may need or take your information under advisement. We're looking forward to working with all of you on this program and hope it will be a very positive experience for all of you. So if no additional comments or questions have come in, I think we can conclude this training for today.
I do have one final comment. We'll try and accommodate this request. Lori Robinson requested that we send the PowerPoint and recording to her email. I'm not sure, just due to size restrictions, but we will certainly try to do that if we can. And then again, it's posted on the department's website, and Angelica has posted the link in the chat for you all.
Okay. Thank you all very much. Would you unmute? I'm trying to look to see how I can unmute. Here we go. In case Angelica or Michael wanted to have any final remarks before we hang up.
No remarks from me. Thank you. Great presentation.
Okay. Well, thank you all so much. Bye-bye.
Thank you.